Hi everyone, in this video I'm going to be talking about congestive heart failure. Congestive heart failure occurs when the heart is not able to pump enough blood to meet your body's anatomical needs. There are two main types of heart failure that I'm going to be discussing, and they are right-sided heart failure and left-sided heart failure. The first type is systolic failure, which is an instance that occurs when the left heart ventricle does not contract normally, which causes less blood circulation because there is not enough force to pump the blood. Diastolic failure is the stiffening of the left heart ventricle, which means that less blood is able to fill the heart with each pump. The job of the left-sided heart is to pump enough oxygen-rich blood to the rest of the body. Left-sided heart failure is also more common than right-sided heart failure. Not only is left heart failure more common than right heart failure, but it is also one of the leading causes of right heart failure. Right-sided heart failure is when the right side is unable to pump enough blood back to the lungs in order to restore the oxygen needed in it for the rest of the body. During left ventricular failure, blood tends to get backed up in the veins. This is what we call congestive heart failure, and that leads to fluid buildup in our lungs, which results in a weaker right-sided heart. Diseases such as obesity or diabetes can lead to heart failure because they cause a buildup of fat in the arteries. This can lead to a heart attack, which can cut off the supply of blood and oxygen in the heart. The muscles of the heart can weaken in these instances, ultimately leading to heart failure. What's interesting about left and right heart failure are the major differences in the symptoms that arise. For example, for left heart failure, one of the prime symptoms for distinction is a blue color on the fingers and lips. Because the job of the left side of the heart is to carry oxygen-rich blood to the rest of the body, a weaker circulation can be physically seen by the naked eye. For the right-sided heart failure, the swelling of our ankles, feet, legs, and abdomen occurs because the veins get clogged up with blood on the left side, causing a buildup of fluid in the lungs, and again, when this happens, the right side of the heart is weaker. There are different ways in which a doctor can detect CHF. An echocardiography uses sound waves, and that generates pictures of the heart. Blood flow can also be seen on this test. A chloride blood test measures chloride in the blood, and chloride in our blood helps with our acid and base balance in our bodies. High brain natriuretic peptide levels occur with heart failure, which can be studied by the brain natriuretic peptide test. A cardiac CT scan assesses the arteries of the heart. Nuclear scans are mostly used for cancers and tumors, but this type of imaging can aid with the heart as well. One more test that doctors use to know for sure if a patient has heart failure is the electrocardiogram. This evaluates the heart using patches on the skin on places like your chest, your arms, and your legs. It's important to recognize that for many chronic illnesses, such as congestive heart failure, there is no cure. A person living with CHF still has the chance of leading a normal life with different options, though. For example, someone with obesity may need to change their diet, which can stop clogging of the arteries. Smoking should 100% be a no for people suffering from this disease, especially with the fluid buildup already taking precedent in the lungs. There's no room to damage your lungs even further. A pacemaker can regulate a heart's rhythm by sending electrical pulses to your heart. Finally, in some cases, a person may end up needing heart surgery, but that's not always the case. What's even better than treating CHF is preventing CHF. There are many changes we can start, even in earlier life stages. This is especially important for people who have familial history of CHF. Many lifestyle changes can be made, for example, exercise and healthy diets. Other preventative measures that can be taken is medication for those who already have high blood pressure, heart rhythm, and high cholesterol. Another measure is a periodic evaluation for those who already have chronic conditions. What's good about knowing the CHF treatment methods is automatically knowing the disease's preventative measures. If we apply lifestyle changes, medication, or pacemakers for regulation, or even spread more public awareness about what CHF really is, we have the possibility of saving the lives of ourselves and others. When it comes to congestive heart failure's correlation with swallowing, one of the key focus points is dysphagia. An easy way to describe dysphagia is having trouble when swallowing. Dysphagia holds many risks such as malnutrition, other bodily infections, and cardiac cachexia, which is weight loss caused by heart failure. Dysphagia patients who don't already suffer from heart failure may eventually have the risk of developing it, however, this is a rare occurrence. Detecting dysphagia or CHF in their earlier stages may prevent the risk of worsening symptoms, and it can also prevent patients who have one disease or the other from getting that second disease. One final thing to consider about congestive heart failure is that the name of the disease does not automatically mean your heart will stop working. Millions of people who suffer from CHF are able to lead normal lives. So that was my presentation, and I hope that you all have a better understanding of what congestive heart failure is.